Good afternoon. This is Taekwondo Hezekiah recording my assessment video for health assessments. My student ID is 000309286. And I'll be doing a head to toe assessment this afternoon on my patient, Mr. Carlos. Carlos, are you in agreement with this assessment?
Yes.
How old are you, Carlos?
32.
Let me see your arm. We're going to start out by doing your vital signs. And do you have any pertinent health history? Like, do you have a history of cancer in your family? Do you have a history of diabetes?
Yeah.
You do?
Mhm.
Okay. Anyone in your family have high blood pressure?
Me?
You? Let's see what it runs today. Mm, 168 over 88. With a pulse of 87. Okay. First, I'm going to check patient's consciousness. Tell me today's date, Carlos.
July the 7th, 2015.
Okay, and what is the name of this building that we're located in?
The VA hospital.
Okay, and how old are you?
32.
Okay, and what are you doing here with me right now?
I'm helping you with your class assignment.
Okay, that's right. Thank you. So I'm looking at the patient's nutritional status, and it seems like the patient is eating adequately. I'm gonna weigh you, Carlos. So let's step on the scale for a minute. Patient is 277.3. You can have a seat back for me on the table. All right. So can you sit up straight for me? I just want to check your posture while you're seated. So tell me how your day's been going today. How are you feeling?
Fine.
Give me a describing word to kind of describe your mood. Are you happy? Are you sad? Are you agitated? Are you motivated?
I guess I would be happy.
Happy? Okay. Patient's speech and articulation is linear and congruent. His mood is congruent with what he's saying, and he's speaking in a regular rate and rhythm. Is English your native tongue, your native language that you speak?
Yes.
Have you noticed any hearing deficits in the last 30 days? Like when people talk to you, is it hard for you to hear?
No.
Okay. At this time, I'm gonna inspect your ears with my otoscope. One thing I forgot to ask you when I was doing your vital signs, are you having any pain anywhere?
No.
Okay. If you'll hold your hand straight out for me, I just want to inspect your nail beds. Your nails are clean. Color's good. No change in pigmentation. No tenderness, no swelling. No moisture noted. I just want to check your turgor. And what I'm checking for is to see if you could be possibly dehydrated. Let's see. Turgor's good. No lesions are present or noticed on your hands. First, I'm gonna start off by inspecting your scalp and your hairline, just checking to see if you have any sores, any places on your head where the hair may not be growing, any changes in pigmentation, any moles that may have changed color recently. Can you look at me? camera woman. Can you smile for me, Carlos? I'm checking your cranial nerves right now. Can you pucker your lips? Can you blink both of your eyes one at a time? Okay. In doing so, the patient was able to follow commands, and there is symmetry on both sides of the face with cranial nerve number 7. Close your eyes for me. When you feel me touch the side of your face, say okay.
Okay. Okay.
Okay. Are you able to open your mouth and clench your teeth together in the back? Open. Clench. Clench your mouth. Or clench your teeth down. Clench. Okay. I was assessing the patient's temporal mandibular joint at that time, and upon palpation, everything is symmetrical. What I'm going to do now is palpate with the tips of my fingertips your maxillary sinus area and tell me if you have any tenderness or pain in this area. Any pain? Any tenderness?
No.
Okay. Any tenderness anywhere when I touch your face?
No.
Okay. All right, the next thing we're going to do is check your visual fields, and I just want to make sure that you're able to follow my commands. What I want you to do is watch the tip of this Q-tip and just follow it with your eyeballs without moving your head, okay? All right, make you do it cross-eyed when I do that. All right. For all purposes, we are gonna say that we have a pen light so that we can check your, I think it might be you got a pen light on your phone? I'm checking your pupil reaction, okay? Let me just turn the light off for 1 second. All right. So, using the pen light, the patient's pupils were reactive to light and accommodation. In just inspecting the patient's outer eye structures, I don't see any problems with his eyelashes. They're both symmetrical. I don't see any exudate coming from the corner of his eyelids. His scleras are white and clear. No redness noted, no irritation or pain. And I'm checking his optic nerve when I'm looking for the red reflex, and I'll do that at this time. Alright, next we're just going to inspect the patient's external ear, and that is going to be his pinna and his tragus, and I'm just going to palpate them. Any pain, tenderness in this area when I do this?
No.
Okay, have you noticed any type of drainage coming from your ears in the last 30 days?
No.
Patient denies any tenderness or drainage at this time. And the purpose of the otoscope is to check the patient's ear canal and eardrum for any fluid or redness, and just to check for patency. So the next insert says to explain the Weber and Rennie test. The Rennie test compares air and bone conduction, which occurs through air near the ear, and bone conduction, hearing, which occurs through vibration. A Weber test determines sensory or conductive hearing loss. Sensory hearing loss happens when an auditory nerve is damaged. The next thing I'm going to do is inspect the patient's nose or nares. So what I'm going to do is take one of my fingers and close off one nair at a time, and I want you to not blow out, but breathe in when I close off that nair, okay? And how was that? No problems with breathing when I closed off on there? Okay. So I'm going to get my, excuse me, hold your head back for me. And I'm just inspecting your nares, looking for any redness, any dry or crusted blood that may have been there. Have you experienced any nosebleeds in the last 30 days?
No.
Okay. I don't see any fresh blood, any crusting, swelling, erythema, or inflammation in the patient's nares. No exudate, and no deviation of his septum upon inspection. Next, we're going to inspect your mouth, okay? I'm going to wash my hands again before we do that. And on inspection, what I'm doing is checking for the color of the patient's lips and buccal mucosa. I'm also checking for moisture and any changes in pigmentation. If I can get these gloves on. Are you having any pain in your gums or mouth area?
Mm.
Okay, so I'm just gonna inspect for any obvious sores or redness, okay? Hope you smile. Say ah. And I'm inspecting your uvula. Alright, so no discoloration noted, no pain in the patient's mouth area. His uvula was midline. Tonsils are intact, no swelling or redness noted, and no drainage coming. Can you stick your tongue out for me one time? Up and down. Can you take it up and down? Okay. Next, I'm gonna palpate the patient's neck, and I'm palpating for any tenderness or lumps or swelling in that area. And it's actually the patient's cervical lymph nodes that I'm palpating. Does that hurt when I do that? I'm doing it one at a time because I don't want to cause your pulse to slow down by massaging it both at the same time. A regular rate and rhythm was noted with the patient's carotid pulse. Next, I'm going to palpate his trachea, so just hold your head straight up for me. And I'm just checking to make sure that it's midline with no tenderness or swelling. Can you swallow for me? Okay. No signs of a aorta noted. Alright, so next we go on to the chest and to the lungs. Typically a patient has 3 lobes on the right side and 2 lobes on the left. And on inspection I can see that Mr. Carlos is displaying equal expansion when he is breathing. Chest appears to be symmetrical. I'm going to just lift your shirt up just to take a look from maybe here up. No discoloration or lumps are noted upon inspection. Can you stand up for me, Carlos? Thanks so much for me. The next thing that I'm going to do is palpate down the patient's spinous process, and I'm just checking for alignment or any tenderness. Does that hurt when I do that? Any pain in that area? Mm-hmm. Okay. Now I'm percussing over the patient's lung fields. Any tenderness when I do that?
No.
Okay. I didn't get my stethoscope. let me hold it right and get me a stethoscope, and I'm gonna keep recording, and I'm gonna hold it on me and Carlos just like this so that they know that it's not a break in this video. Just bear with us 1 minute. We're running to get a stethoscope. Alright, he should be about halfway through with this. Two more sheets on halfway through. Then we go right through into this. I should get to. Sorry about the interlude. All right, thank you. All right, so we're gonna continue on with this assessment. And what I'm gonna do is auscultate the patient's lungs, and I'm just checking for air exchange. Take a deep breath in and out. And I'm gonna listen in the back too. Okay. No adventitious sounds were noted. Alright, so the patient's respirations were even and unlabored, and no use of his intercostal muscles. No tactile phlegmatis was noted. Lung fills were percussed. No fluid buildup was noted, and breath sounds were auscultated with a stethoscope and are clear and unlabored. So the next thing that we're going to check are your upper extremities, and that's your arms, okay? And I'm checking for muscle strength right now, so can you squeeze my hands at the same time as far as you can? Okay. So I'm just going to talk through the process of assessing a patient's breast or their axilla. What you want to do is start at the nipple and work your way out using the pads of the two middle fingers and up to the axilla, checking for any drainage from the nipple, any pain, tenderness, redness, or warmth. The next thing we're going to check is the patient's neck vessels, and we're checking for any checking his jugular venous pulse. So I'm just going to palpate those one at a time and checking for rate and rhythm. Close your legs flat back for me, and then I'm going to assist you to sit back up, and I'm just checking for jugular vein distension, and sometimes it's more easy to know when changing position. So, okay. Okay, so no jugular vein distension was noted. I'm going to check the patient's pre-cording them, and I'm gonna do that on inspection of the heart, and I shouldn't see any type of pulsations in that area. So if you'll just lift your shirt up for me, probably right at the nipple range. And I'm gonna listen to the apical pulse, and this is gonna be done at the 4th or 5th left intercostal space directly under the apex of the heart, and I'm checking for a regular rate and rhythm. Right. Apical pulses are a regular rate and rhythm of 75. S1 and S2 heart sounds were auscultated and no murmurs or ventricular gallops noted at this time. All right, Carlos. Next, we're gonna look at your abdomen, and I kind of looked at it when you had your shirt up, so I'm checking for any symmetry to make sure that the muscles they're aligned and nothing is kind of like drooping or hanging. The color is brown, and no pulsations were noted. So next, I'm gonna listen to your bowel sounds in the 4 different quadrants and make sure that they're all present. Okay. Alright, no vascular sounds were noted. If you will lay back for me, Carlos, I'm just gonna palpate over your liver. And tell me if this is painful when I do this. Okay. Any tenderness? No? Okay. So no tenderness noted, no enlargement of the liver noted. And if you sit back up for me, I'm just gonna do the same thing on your back for your kidneys. Any tenderness or pain when I do that? Okay. So, if you'll stand up for me, the next thing that we're gonna check is your inguinal area. And I'm just checking. To see if your pulses are palpable. And they are. And there is no swelling or tenderness noted upon palpation. So the next thing that we're gonna check are your lower extremities. So if you have a seat for me, we're gonna lift your pants up. And I'm basically just checking hair distribution. I'm checking to see if you have any sores, any open areas, any warmth, tenderness, swelling, or redness. And you don't have any on that leg. Okay. Next thing we're going to do is palpate your pulses, and the first one is the popliteal pulse, and that one is located behind your knees. Okay, the next one is the posterior tibial pulse, and that one is done inside of your ankles. And the last one is the dorsalis pedis, and that one is done on top of your foot. So if you take your shoes off for me, I'll see if I can palpate that one. And okay. All right. Pulses were all palpable. No edema was noted. Let me see if the patient has all of his toes. Alright, patient has all of his toes. Ooh, color. Alright, put that one back on for me. Let me just wash my hands. wiggle his toes freely and able to point and flex them down. So he point and flex them down. Okay. Range of motion was done in the patient's ankles and feet, and he was able to point and flex. Now I am going to check the patient's neurological status. And what I'm going to do is have the patient to close his eyes again, and I may have done this earlier, but I'm going to do it again. And tell me when you feel me touch you. Okay. With your eyes closed.
Touch it. 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 Touch it.
Okay. So, can you stand up for me? Close your eyes. And now I'm just checking the patient's position sense. Keep them closed. Do you feel your body swinging any, or do you think you're standing straight up and down?
Standing straight up and down.
Okay. Next, we're going to check the patient's stereognosis. So close your eyes. I'm going to place something in your hand, and just by feeling this object in your hand, you tell me if you're able to tell me what it is. And it's a common object that we use on the floor every day for labs.
It's one of those test tubes.
Test tube? Alright.
the blood thing.
Alright. So, I want you to do a turn demonstration, and what I want you to do, and I'm checking your cerebellar function right now. Take the tip of your finger, and without turning your head, see if you can bring it directly into your nose. And do the other side. I'm just checking symmetry to make sure that you can do it on both sides. Okay. The next thing that we're going to do to check your cerebellar function is the heel to shin test. So what you're going to do is take the heel of your foot. I can't even do it. Take the heel of your foot, put it on your shin, and rub it down. And we're just checking for balance to make sure that you can balance yourself. Okay. Walk across the room, heel to toe. And we're just checking musculoskeletal. Are you able to do it? Okay. So, I need for you to walk on your tiptoes and then walk on your heels. So, tiptoes. And then come back on your heels. So just stand still for me with your eyes closed, and I'm checking your balance again. No balance problems are noted. Are you able to do a shallow knee bend? Okay. Can you lean forward for me? You can open your eyes. You can open your eyes. I'm sorry. Lean forward for me. Now lean to the side and lean backwards. And we're checking your range of motion of your spine, and everything seems to be okay. No problems noted in that area. And I do believe, Mr. Carlos, that is all of our assessment. I think that's it. So thank you so much.